Good evening, everybody. I'm Linda Luxon, and I'm a trustee at the Royal Society of Medicine, and I'm delighted to welcome you all to this last in our 10-part series on the health emergency of climate change. I'd like to start this evening by showing you an introduction to the series and to this programme from Jeremy Farrar, who is the director of the Wellcome Trust and has a particular interest in climate change.
I'm delighted to join the Royal Society of Medicine in this health emergency and climate change conference. Thank you very much for the invitation. Climate change is happening now. It's often portrayed as something that will happen 20, 30, 40 years from now, but we know whether it's pollution, whether it is excess heat, or whether it's where vectors fly and carry disease. We know that the impacts on health of climate change are happening now. And too often we've put climate change as something that will maybe happen to our children or our grandchildren. We've got to bring the sense of urgency into this. And healthcare and healthcare professionals and health research has got a critical role to play in this, making it immediate, making us all appreciate this change is happening now and will affect everything we do. So I applaud the Royal Society of Medicine for bringing this issue forward, and I'm delighted to contribute in some small way, as Wellcome is in the years to come. Thank you very much indeed.
Well, thank you very much, Jeremy. That's an excellent introduction to this evening, not least because Jeremy's highlighted the fact that it's children and our grandchildren that are really going to suffer from the consequences of what's been happening, particularly over the last 50 or 60 years. So I'd like now to allow you to listen to some comments from children around the world and what they think about climate change.
Hello, my name is Oriana and I'm 12 years old.
And my name's Xavier. I'm 9. We live in the United Kingdom.
We have become aware of how much greenhouse gases are released into our environment. It's loads. Every time you turn on your car, turn on your heating or use electricity, you are using up fossil fuels that create greenhouse gases such as CO2. These gases make our planet much hotter, melting the poles and causing floods, which increases rainfall. These pollute our rivers with sewage and spreads disease. And this is a threat to humanity. Our biggest threat is us, which means that we can solve this.
We know how to solve this. Walk instead of drive, eat less meat, turn off the lights, don't use air conditioning and heating as much. Get leaders around the world to change their priorities.
Please, let us save the planet to save ourselves.
Thank you.
Good day, my name is Barak, he is Gineka, I am 12, he is 16, and we both live in Abuja, Nigeria. So Gineka, what aspect of climate change do you want to talk about?
Today I'm talking about the impact of plastic waste on the environment of Nigeria. Currently in Nigeria, plastic waste often ends up in the streets and in the gutters of oceans and rivers. When there's heavy rainfall, the gutters get blocked because they are full of plastic waste, and this adds to the flooding of streets when there's heavy rainfall.
Why else is this a problem?
This is also a problem because plastic waste impacts marine wildlife, and the plastic packaging is ingested by animals through the marine food chain, which is a problem as plastic waste contains pollutants.
So Gineka, what needs to be done?
I think there needs to be urgent action in Nigeria to ensure that more environmentally friendly packaging is used and increasing the rate of recycling of plastic waste. And finally, improving waste disposal facilities to make sure that waste is properly disposed of. Thank you for listening to my speech.
Hi, I'm Tuta, I'm 10 and I'm from Myanmar. I know about climate change from my school books. It said about global warming and change in ecosystems. Moreover, last year I was unable to go to physical school and play with my friends. In the future, I'd want doctors who are able to control these diseases, including COVID. I want people to enjoy their lives as normal without worries about diseases, floods, food, extreme conditions, and more. Thank you. Bye-bye.
My name is Lira and I'm 14 years old.
My name is Joshua and I'm 9 years old.
My name is Leslie and I'm 12 years old, and we all live in Nairobi, Kenya.
So, what is climate change?
I know that it's a major problem for the international community that we need to solve.
Climate change is related to global warming and long-term changes in the atmosphere, which are caused by carbon dioxide accumulating in the air, which creates the greenhouse effect.
Why is climate change so important?
Climate change is important because it impacts our life, and our actions determine the weather.
In all honesty, we only have one world and we need to protect it.
How does climate change affect our health?
Climate change affects our health in many ways, like through extreme weather, like floods, droughts, extreme cold, tornadoes, heat waves, etc.
Climate change causes flooding, which causes waterborne diseases, like cholera and diarrhea. Also, poor air quality caused by air pollution and diseases by insects and rodents, and dehydration, which causes heat stress.
What can we do?
We can stop using fossil fuels, and we can also reduce our meat intake because in cows there's methane, which is a toxic gas. And we can also start to use renewable energy resources such as solar energy and hydro energy.
We need to build health systems that take care of the elderly, children, pregnant women, and people with chronic diseases. Thank you.
Thank you.
Namaste, I'm Agastya and I'm 9 years old. I live in the Himalayan state of India, Uttarakhand. I've heard so much of cloudbursts, flooding and landslides in the last few years. Out here, road widening, cutting forests, mining, etc. are diverting rivers, affecting so many people and nature. Climate change is real. I want everyone to pay attention to how they can help address this. And this needs to be done now. Else we children and our children will have nothing left. Thank you.
Well, I think Augusta's summed it up admirably. We've got to do something now, otherwise there isn't going to be a future for all of us. So tonight, what can we do as healthcare professionals? And we're going to have a discussion, and I'm delighted to introduce three really outstanding colleagues who have worked in this field for an enormous number of years between them, and all of them have worked in it for a long time. So I'd like to start by introducing our youngest member, who is going to undoubtedly be impacted by this in the future if we're not acting. And that's Dr. Rita Issa, who's a humanitarian doctor who works part-time as an NHS GP, but also does academic and advocacy work. So Rita, please tell us a tiny bit about yourself.
Great, thank you for having me. And those children have really set a high bar on public speaking. So I'm an NHS GP, I'm a clinical research fellow in climate change, migration and health, and I have been a climate activist for about 10 years. And most recently that's taken the form as being one of the co-founders of Doctors for Extinction Rebellion. So I'd like to speak very briefly about my journey to becoming a climate activist, and then some recent work that I've done, which has been mapping the climate change and health movement in England. So 12 years ago, I was at university, and I went to a protest called Climate Camp, and I'd never really been to any protests before, but the energy and the passion of the people there was inspirational, and importantly, it was very hopeful. And so I became an activist on the weekend, but it was something that I kept completely separate from my life as a doctor. And over time, I began to try and converge these two parts of my life. So I worked briefly in the WHO's climate change department, thinking, finally, I can have an impact through this institution. And I also became involved in the fossil fuel divestment movement that was happening at the BMA. But I felt somewhat conflicted because working within institutions meant that I was somewhat bound by institutional norms, by their vision, and by some of the bureaucracy that exists within them. And while I recognized that obviously slow internal and institutional work is really important, it didn't quite meet me at my heart. It didn't meet the inner urgency and fear that I felt around the climate crisis. And so when Extinction Rebellion hit the scenes in 2018, I felt really excited that others were feeling what I was feeling. And so I attended again, but not in my capacity as a health professional. And soon I and others found that the movement was being downplayed as being crusties and hippies. There I was as a doctor, marching in the streets, because my voice hadn't been heard through all of the institutions and all of the means that I'd tried so far. I was marching because I care about the health of my patients, and I recognize that climate change is one of the greater health threats that we have globally. To me, not to act on the climate crisis went against my duties as a doctor, where I'm bound by good clinical practice to hold human life with utmost respect and to practice from a scientific evidence base. I didn't know how I could not take action on the climate crisis. But given that XR was being denounced as being hippies and crustates, me and some other doctors set up Doctors for Extinction Rebellion. We wanted to provide some legitimacy to the movement, and that's in recognition of the fact that we are respected and we're listened to. It's a privilege in society that few others have. And Doctors for XR has done many actions. Some have been artistic, some have been somber. Tens of doctors have made a very difficult decision to choose to be arrested. And since founding the group, thousands of doctors have been involved. We've received support from the Lancet, the British Medical Journal, and we've made headline news. Health workers can be very powerful in that way. And while all that's been going on, I've also been thinking about how change happens. And it turns out that there's a whole social science dedicated to the study of it, which is called theory of change. And what theory of change says is that individuals and institutions will have beliefs and assumptions about how change happens. Sometimes that's conscious and sometimes that's subconscious. And the beliefs that we have will determine who an organization might choose to influence, the methods that we might use, and some of the desired outcomes. And I and some others have written a paper which is going to be published in November around the time of COP. We've mapped the climate change and health movement in England, and we've tried to understand what the wider theory of change is for the movement. How do we collectively as health professionals think change is going to happen? And briefly, what we found is that there are over 70 groups working on climate change and health in England alone, and the majority have formed since 2015. Most, I guess somewhat unsurprisingly, are working to change things within the profession at the sort of individual and sectoral level. They might be working on procurement through their specialties or the Royal Colleges, in their trusts or GP practices. And obviously there is a role for that in ecosystem change. But where I see part of the movement falling short is a broader vision that can only really come about through top-down, possibly quite radical political will. And what we argue in the paper is that the health profession may have a role to play in wider advocacy at the broader systems level. Currently, our work is pretty isolated, but we could be of service to the wider climate change movement. And I don't think we've quite tapped into the potential of that. So I'm going to leave it there for now because I think it's going to come up in the Q&A about how we can bring about change. And I really look forward to hearing the other speakers. Thanks.
Rita, thank you very much. Well, we're delighted to have you with us tonight. And obviously you've got expertise across a broad range of elements that will certainly make a difference to climate change mitigation, which is what we must be about. David Pencheon, I'm sure hardly needs any introduction. David has been at the forefront of UK climate change issues and debate since at least 2007, when he became the founding director of the Sustainable Development Unit for NHS England and Public Health England, and is now an honorary professor at the University of Exeter, teaching many of our young students. So David, please just say a word or two about where you are in life with this area.
Well, thanks very much indeed, Linda. So my background really is not that dissimilar to Rita's, except she's done it far better and far more swiftly than I have. So I've been sort of working in a personal capacity on advocacy for environmentalism since the early 1970s. And I guess that means I've made almost every mistake in the book in terms of how to engage organizations, people, systems on what is almost undoubtedly the defining issue of our time globally. And Rita and the young people we heard just put it wonderfully, that, you know, this is of a scale and of a magnitude that makes us realize that we as human beings just don't understand words like now and exponential and priorities. And I suppose what I've been doing more recently, other than the time between 2007 and 2018, where we sort of institutionalized it, this whole business formally in the NHS in England, and sort of normalized it and gave permission to people to make it, as Rita says, a duty of care. This isn't something that we should be doing, you know, covertly, apologetically, when we've got time in the lunch hour. This is first and foremost one of our duties of care, to be first-class doctors and nurses and managers, not second-class climate scientists. So one of the things that I guess I stumbled across is the importance of framing. This relates to Rita's point about theories of change. Framing climate change as a health issue. It is our duty of care. We are doing dangerous things as health professionals by saying nothing. We don't need to be experts. We don't need to have lots of time. We just need to respond in a way that says, yes, it's important. Yes, I'm anxious. Yes, we should be doing something. I may not know exactly what to do, but by saying nothing, it is dangerous for us to do that. So I spend a lot of my time now coaching people about how to have smarter, more clever communications with their colleagues, and where we can turn urgency into agency. Thanks, Linda.
Thank you so much, David. And again, I'm absolutely delighted you're here to discuss this with us tonight. And finally, I'm really, really pleased to be able to introduce Dr. Cheryl Holder. And just before I say anything about her, I would advise you to watch the TED program that Cheryl speaks on. It is superb. But Cheryl is president of the Florida State Medical Association and co-chair of the Florida Clinicians for Climate Action. So Cheryl, please tell us a little bit about all your work, which has been so centered on inequalities for health and climate change.
There, afternoon in my time. And I am really happy to be here and speak on climate and health and tell a little bit about my climate story, which, similar to Dr. Rita, goes back a lot longer than hers, because I've been out for a lot longer. But I've always been involved in community medicine, and that's from coming through medical school, being in what we call the National Health Service Corps, working with poorer communities, and coming out at a time with HIV/AIDS and living through that pandemic, living through that pain, seeing who was affected, and recognizing the role that we played as clinicians to be activists, advocates, educators, and looking at the disease as a holistic approach. If you were going to help my moms who were getting infected, I had to get babysitting, I had to get everything. I had to look at all the social determinants. So as I started treating my patients again, back in 2016, I had a patient who came in and talked about not paying her light bill. And it seemed so simple. She wasn't paying her light bill. She was using up her asthma's inhaler. And really, she was responding to the heat. And the heat was creating a lot of triggers. I'm in Florida, the poor housing, the heat, I'm seeing allergies. I'm seeing my young children, because I used to work at a community health center and I was the medical director, and all the young Black males with their asthma and their triggers and living near highways and all the factors that were coming together. And it was finally that I put it together, and I realized so much that as this climate's changing, my patients were screaming and they were impacted now. So much of the framing and what Dr. David said before about framing it, where we were looking at it in 50 years, it was polar bears, it was my patients now. And so if we didn't speak up, as what happened back in HIV, we would see the devastation. Because when you look even further back, the factors that we see, the pollution, the greenhouse gases, the population that I care for have been having asthma. They've been having cancers. I look around the Louisiana Cancer Alley. These were populations that were reacting to the pollution, to what we were doing to our climate. And instead of us responding and valuing the population, we kept putting it not in my backyard, putting it somewhere else. And so the deeper issue in our society comes back again to equity and looking at the policies that drove a population to be impacted. My patient didn't just end up in that poor neighborhood because she wanted to live there. That was pretty much her only option when you look at redlining and segregation. Cancer Alley didn't just happen, but it became because we have a system that devalued people based on, in our country and in many parts of the world, based on race. There's socioeconomic, there are many factors, and just how pollution is impacted across the world that's driving this climate change. So as I became more involved and understood, we had to act. And that's where what I do now in forming the Florida Clinicians for Climate Action has been about 3-4 years, similar to what the data shows. A lot of this work started after 2015 because the voices came together to recognize that the health impacts are so severe. But in my population, it is absolutely not new, but for so many years, the population I care for have ignored. So as we work on this climate change, what we say in my world is that if we look at an equitable response, where we center the population that's impacted now, we will absolutely come up with solutions that cause that much more rapid decline. So rather than looking for solutions like carbon trapping, which we say go for it, but look at what the population needs now, worldwide, much of the poorer populations, and we'll get some climate solutions, which are always health solutions. So centering health is centering life, because health is a lot more than the physical loss, but is where you live, where you work, where you play. And if we address those factors, especially for poorer people, we will get an immediate response and achieve that reduction in less than 10 years. Thank you.
That's great, Cheryl. Thank you so much. And thank you very much for being with us today. Well, I suppose what I would start by saying is that we've all touched on the fact that we're healthcare professionals. So let's start with thinking about how do we have conversations with patients? You know, when do we have them? And what might we say that's helpful generally? I mean, David, would you like to start off on that?
Yes, thanks, Lynn. This is a really good question because, as Rita said before, health professionals are dangerously influential. People actually believe what we say, whether we're right or wrong. So, and the political mandate for change will not just come from health professionals. They'll come from the public in general. In the NHS, we interact with 1 million people every 36 hours. That is a huge opportunity. But, and I think there's a very big but, I think we as health professionals should not proactively berate our patients. I think that's not a good idea. It might be acceptable to say, have you thought about cutting down your smoking, or have you thought about changing your diet? I don't think it's acceptable to say, have you thought about climate change? I think that's a big leap. However, I think it's very important for us as health professionals to have a very good answer when patients say, I've heard climate change is a health issue. Is that true, doc? Or is that trueness? You need a really good answer for that. Because if you start by saying, that's not my business, I'm a doctor, not a climate scientist, I think you've lost the whole narrative completely, that this is of our time. It is a profound health and equity issue. So, and it's very interesting because there are some great med students at the Royal Free Hospital here in London who've written a very thoughtful blog in the BMJ about what should we be saying to patients? How should we be responding to their absolutely legitimate inquiries? And of course, those conversations, Linda, that we have with patients can be done directly, but they can also be done indirectly. So how we as doctors behave, whether we turn up to the hospital on a bike or in an SUV, you know, whether we put notices in our waiting rooms that say this hospital runs on renewable energy that protects the climate and saves money. These are all very important direct and indirect messages to normalize the fact there's no sector of society that's too important or to ignore this issue, and to be a good advocate and supporter of other people who are anxious, concerned, worried. And that's our job, to support people. And of course, we've got to support ourselves too as well. So, you know, sustainability starts with number one. So have these conversations with yourself, practice them on yourself, and then have them with other people. So that would be, I think this issue about how we engage patients is very, very important. But I think most of it is through indirect messaging and having very good responses to their inquiries.
Yeah, great, David.
I'm sure
Cheryl,
Rita will have something to add to that.
Yeah, Rita, go ahead. What would you say?
Yeah, Maybe I'll just jump in on that and say that I think often expecting individuals to change their behavior becomes an issue of justice, because in our society as it is at the moment, making choices which are going to be best for the climate and often best for health as well are often very inaccessible to people. They're inaccessible because of knowledge, and they're inaccessible because of cost. And I think it's important in our role as health professionals to think, well, how can we ease that process? So how do we do that in terms of prescription choices? How do we do that in terms of the food that's offered in our hospital canteens? How do we do that in terms of the transport in the local area around our clinics and around our hospitals? And can we streamline it so that patients and our local communities can make choices that are going to be better for the climate and also better for their health as well? And so I think it doesn't need to take an individual to make that choice if it's going to be cheaper, easier, and better for them to do so anyway.
Absolutely. Excellent. Thank you. And Cheryl, how do you go about it? Tell us what you do.
Well, unfortunately, or maybe fortunately for me, many of my patients it's easy to make the connection once I do it, because they live they don't have air conditioning. I live in Florida. So even if they have air conditioning, they can't pay the bill. So they recognize when, my God, it's hot all day, all night, longer periods. They see the changes a lot earlier. They know they can't run the AC all night. I have a lot of outdoor workers, and they work and they feel the difference. I have people who live in heat islands where they can go outside and they feel it. If you take the buses, many of our bus shelters are not covered. So when I start connecting the dots and I tell them, yeah, they say they know, they see it, they feel it. However, where the problem comes is, what can I do about it? And so that's the difficulty part, that I have the challenges in how we can find little things, how we can start having them feel more empowered, that even within their sphere in these difficult neighborhoods, that there are things that they can do. And what I really push for is much more of the advocacy, working together, having them find ways to talk with their community, their neighbors, their family. And so as a collective voice, and that's where I work a lot with clinicians who work in these communities to help the patients figure out ways that they can get their voices to get it to the vote and advocacy, because they often understand that things have changed and they are feeling it, but they are feeling a little bit powerless.
Well, I suspect recently with the, I'm sure we've seen in the press about the terrible wildfires and heat in North America, and I'm sure you've seen about the terrible floods and rain in Europe. So I think even in the developed countries, people are beginning to realize that it really does affect all of us now, not 10 years hence. May I just turn for a second to some of the questions that are coming into us? And there's a couple of questions about healthy eating, basically. And one is, what's holding doctors and medical professionals back from promoting less eating of red meat and promoting a diet of plant-based foods? And why are we not doing something about this? So how should we go about that? You can't legalize what you eat, for goodness sake. So how do you think we should do that? How can we bring that into the conversations with patients?
I really believe in meeting patients where they are. So as much as I push for eating less red meat, because it's a health solution. So beyond, I said, these are where health solutions, which my patient can understand, is also a climate solution. So it's not that I'm giving up meat only to save the planet. I am like, your blood pressure is up, your cholesterol is up, you've overweight, and our problem in the developed world with weight, that this is a solution that also helps our planet. And I meet them where they are. And gradually, I'm getting folks give up meat for one day and making better choices in meats and having more chicken and some other things that they can do slowly. But it's very difficult to push people. I don't believe in pushing change, lecturing. So you motivate folks, empower them, and have them buy into the system. And it will take some time, but I've had some successes with just giving up one day.
I think that's right. I think what's fascinating. Cheryl's absolutely right. Food is an unbelievably cultural issue. This is not a technical issue. This is a cultural issue. And absolutely, as Cheryl says, one of the things we can do is instead of taking meat off the menu, is just to make the non-meat menus so fabulous that why would you ever want to kill an animal? I mean, it just does not make any sense at all. I suppose the second point is that health systems around the world are so big. I mean, that you'll always catch someone doing something innovative, even if they're doing it by accident or for another reason. So we in health systems have got this enormous opportunity to say, oh, well, look at what they're doing in Malaysia, look what they're doing in southern Alaska. I mean, in Malaysia, there are plenty of hospitals that serve no meat at all. Okay, so it's not that it can't be done, it's perfectly possible. I mean, this is a side of giving TPN, but this is perfectly possible thing to do. This is a cultural issue. So one of the best ways of introducing change, large-scale change in a complex system like a health service, is to find someone who's doing it already and just big it up. And there are plenty of examples, even here in England, actually, of absolutely innovative diets. And of course, what matters most, and I was on national television when I'd written something exactly what this great question said about we should reduce our dependence on meat in hospitals, set an example, save money, save the planet, blah, 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 blah. And of course, the popular press went doolally. They just would not have any of this. So Channel 4 very wisely, but rather terrifyingly, got some patients to do some vox pops about this. And the patients were saying, hey, look, I don't need to eat meat every meal. You know, as Cheryl says, you know, I can go a few days without meat. And that's far more powerful than any policy wonk or doctor like me can say anything. You know, hearing it from fellow citizens who say, actually, the food here is wonderful. I don't want to eat strawberries at Christmas. I want good, fantastic food. If it's seasonal, if it's fresh, if it's local, that's great. But most important, it's healthy for me and for other people. Yeah. Sorry,
Rita, do come in. No, great, David. Thank you.
Just to jump in on that and say, so I've been working at the Bromley by Bow Centre for the past 3 years, and it's the birthplace of social prescribing. And we've got some great initiatives going on at the GP practice. So we have a community vegetable garden where I can refer patients to go and spend time in the garden with some of our gardeners and learn about food growing. We have cooking programs, and often I think when people are given the choice and given the knowledge and able to put their hands in the soil and able to spend time with community and know that it's also good for their mental health and it's good for community building, and they get to take some vegetables home with them at the end of the day, then that's a really great way of promoting that. And it's this question of how can our hospitals and our clinics be health promoting beyond what they currently are. I don't think we need to be getting our patients to just a low baseline level. How can we use it as an opportunity to promote health into being something beyond just the physical as well?
Yes, no, I think that's one of the really key factors about health service. It was set up to deal with illness. Now it should be more directed to keeping everybody well, rather than purely directed at illness. But there's a very nice question here from somebody who's I'm delighted to be joining us tonight, who's one of the therapists in our field, a healthcare therapist. And she's asking, she's really engaged with climate change, and she's saying, how should she deal with patients? Because obviously she perhaps isn't going to, I suppose if they're overweight, I don't know which profession she's in, but I suppose she can talk about food in that regard. But what else might she do? That's what she's asking. How can she approach patients as a therapist? I mean, perhaps she's a speech and language therapist, for instance, or she talks about mental health and the interaction. So maybe she's a mental health nurse or something of this sort. How could she approach it, do you think?
That's again a very tricky question, a very sensitive question. I mean,
yes.
When you're a therapist with a patient, you're in a power relationship. There is a power relationship. So I think you've got to be very careful and very sensitive. And it's ages since I was a clinician, so I can't talk with any authority. But I think there is something about using the small talk of your consultation, not the big talk of your consultation. So nearly all consultations have small talk, and that's a much more gentle, far less provocative or nannying way to introduce topics. And you can direct the conversation at yourself by, talking about what's in your lunchbox or why you're perspiring so much because you couldn't find anywhere to put your bike or something. I mean, but you've got to give license to introduce the topic as a normal topic of conversation about how we live our lives, today, whether because we're all citizens.
Yeah, absolutely, David. And I guess with the recent, certainly in the UK, the recent climate changes, it's quite easy to introduce it as an absolutely everyday topic of conversation. Right, can we move on a little bit from patients, because there's several questions that are related to the fact that the healthcare industry, if I can put it like that, generates a vast amount of climate change, and what can we do about that? So one of the questions is, how can doctors actually influence beyond medicine to make a difference? I suppose that refers to governments and other bodies. So any thoughts on that, Cheryl? Have you had any experience? Because obviously you're dealing with, you've said that you're able to get communities together to advocate better to improve their situation.
Yeah, okay. My microphone wasn't quite working. Doctors have a huge role. Just like we heard before, we're trusted messengers. We tend to be in our country more conservative and less willing to step out. But again, I use my HIV experience. If doctors are understanding that we're working for the health and the health improvement, and it becomes less political in the sense that we're choosing a party. I find that we're able to mobilize their response. So I'm able to get physicians who will do talks with their colleagues or talks in the community on climate, especially when I have them find that patient. And when I ask them, everybody has had a patient, if you start looking, who's been impacted by heat, or like the therapist asked about the mental health. There are some communities where women are saying they don't want to have children because they're so afraid, and that fear factor. And I'm like, give them examples of that we made it 30 years. We're almost with HIV, when you think about it, in 30 years, we took people who are dying to a normal life expectancy. Mm-hmm. We just developed the coronavirus vaccine in rapid time based on technology. So there's so much evidence that we're going to get there. So as we get the doctors more understanding that it's not a hopeless thing, and some of the health solutions, again, are all climate solutions. So if you're advocating for health solutions towards climate, you will get doctors in. So the doctors' voices become much more powerful beyond the one-on-one, but to really work together with other organizations. So our organization collaborates with pretty much 20 other climate organizations. We're signing on letters. We're getting more doctors to speak up for health, because we know these health solutions and climate solutions all work together. And we focus again on the real issues and help. If you cannot tell me you're not going to fight redlining, you're not going to fight urban heat islands, if you're an obstetric gynecologist, when you know that's related to a lot of our poor Black women having these poor maternal outcomes. Mm. So if you're trying to improve the life of that pregnant woman, you're going to get involved. So this is what we just have to do, the connecting and framing it in a way that they're part of solving a health issue, solving the community's issue, and not being partisan.
And Rita, perhaps you could tell us a bit about what goes on in Bromley, because I realise that's a really forward-looking organisation.
Yeah, well, I was just going to just build on what Cheryl has said. There's been some research done with patient and population groups to see what messaging lands best about the climate crisis. How best can we talk about the climate crisis? And they've tested national security messaging, and they've tested ecological destruction messaging. And actually, the thing that lands best is speaking about the climate crisis in terms of health. And I think once we know that, we're actually doing the movement a disservice if we don't use the health voice to talk about this more broadly. I think we are still very insular, and we think of ourselves as, we're very focused on changing our own system, which is, of course, important, but we can be of so much more service to the wider movement. And I think also we need to remember that we're sort of trained in this. I think often, health professionals can be quite humble, but we are trained as scientists, and our role is to take quite complex scientific information and translate it and present it to our patients in a way that's going to be understandable, that encourages change, where we can see risk and recognize what we need to do to act on that risk to mitigate it. And so there is a role of health professionals to do that. And one of the things that we're doing in the run-up to COP is training health professionals to be media spokespeople? How can we step up at the time of this big international meeting and talk about how health is going to be impacted by climate change? And I can come back to the Bromley question.
Absolutely fine. Thank you. No, that's great. I mean, because this question is really directed at societal change. So that's great. David, you've had lots to do, obviously, with government. So tell us about how you feel healthcare professionals can really play a role there.
Yeah, well, first of all, numbers matter. Numbers hugely matter. You know, the old adage of, you know, one person's a crank, two people's a pressure group, three people's public opinion. So numbers matter. So we've really got to hunt in packs. One of the ways in which we can do that, of course, as health professionals, is to absolutely put the pressure on our medical associations, our journals, and some medical associations around the world and some journals around the world have been outstandingly good, but others have still not got the idea that, you know, the climate crisis makes, I don't want to compare it to COVID or tobacco or to HIV, because this is not a competition. This is not my crisis is bigger than your crisis, but we are not good. I mean, Rita absolutely says that we are scientists, but we tend to be technical, quantitative scientists. We're not great as looking at how people feel. And my experience, directly trying to answer your question, Linda, is you have to engage people both emotionally and rationally. If you just go for the rational without taking any account of their values, that's just not going to fall on good land. It's just not going to work. And the evidence, we know the evidence, we've known that for a long time. And actually, exactly as Rita says, in our consultations with patients, we automatically adopt our style, adopt our framing, adopt our model of change to fit in with what we're hearing from our patients. If they want an assertive, directive consultation, that's what we'll give them. If they want to debate something, we'll debate. That's our job. That's our professional role. But I'm not sure we're translating that sensitivity to different modes of engaging politicians or policymakers or the public in the same nuanced ways. I think we're fairly blunt, and we're still largely in the old world of give them the information, they'll change their attitudes, and then they'll change their behavior. That's just not, there's no evidence that works at all. You know, we often tend to, you know, act our way into a new way of thinking. We don't often think our way into a new way of acting, and we've got to appreciate the science behind how change happens and model, in fact, not the model of change, but it's the models, plural, of change, contextual models that really matter. What will activate a person or a policymaker in one situation will not do it in another situation. And I often say well, it's not called lobbying, it's called policy shaping, really, but the sort of skills that will get you through a door of a minister's door are completely different than the skills that will engage the minister when you're in the room and keep you in the room. So sure, we need our Rottweilers to, you know, make a noise, but then they need to be put back in the cupboard when you're in the room, and then you've got to work very constructively and very empathetically and very diplomatically, but you know, in an evidence-based, sensitive, sharp, assertive way. So these ways in which we do it, and there are plenty of bits of evidence about how change happens if we open our minds to how that has happened in other areas, whether it's changing legislation or changing social movements or changing the effectiveness of advocacy groups. So there is a lot of science out there. So don't think that because we're passionate about this, it gives us license to ignore the science. It absolutely does not.
No, right. I think that's absolutely right. I mean, one of the interesting things that's come in as sort of a parallel issue is it worth health trying to work with faith communities around climate issues?
Absolutely. There's no community we shouldn't work with. I mean, there's no community that hasn't got something to offer to this. We've got something as health professionals to offer, but other people have got, you know, it doesn't matter whether you're a psychoanalyst or a stand-up comedian, we've got something to offer. Quite often, of course, the real movement comes from the space between, about how different groups show wider society that we're united by more than when we're disunited. You know, it's the space between how we collaborate with previously very different groups, and that's why the tragedy of the US, where it's become such a political issue, that we have to depoliticize this in terms of right left, and it's just so sad when we see it become a creature of the left.
Cheryl, how do you think we're going to do that?
Yeah, well, the faith community offers a great opportunity, especially for me and the population I care for, and Black communities, which tend to be very strong in their faith. If you look at the data, we're the highest attendees of churches in the US, percentage-wise. So, and when you look at what religion and Christianity talks about, and I think also Judaism and pretty much all religion talks about the sanctity of the earth and protecting the earth, it's a natural partnership. Also, if you look at indigenous approaches, which I think we often need to come back to, where there's a sense of obligation to managing the earth and being part of the earth and looking forward to the next generation. So I think this climate gives an opportunity again to bring back, for all those folks who are worried about that we're getting less religious, this is an opportunity to jump in and get religion back into what could motivate people to make that change. And also bring back a native indigenous perspective that we've pretty much pushed back and oppressed for centuries, which would, if we had used some of that approach in how we address the land, we wouldn't be in this position that we're in. So the faith is a great opportunity, and we need to engage them more. Some of the biggest voices should come from the faith community if they're going to be true to their religion and involving the indigenous people, because they've always been true to protecting the earth.
I think one of the best examples, Linda, just a very quick example to build on that, is if you read the papal, I'm not a Catholic, but if you read the papal encyclical, Laudate Si, from a few years ago, read the first 1,000 words of that. It perfectly frames in an evidence-based and emotionally compelling way the urgency and the equity issues of climate change. Compare it with the first few pages of the IPCC report on health, which I have a huge faith, I have huge respect for IPCC. But if you want to engage someone, then read the papal encyclical. Yes. That is written in a compelling way, which weaves together the evidence, the moral authority of a faith group, and it's well translated into dozens of languages.
Great, that's really interesting. Thank you, David. I suppose, I mean, I would also ask, I mean, again, changing tack a little, I mean, but how do we engage with other disciplines? You know, how do we engage with the construction industry? How do we engage with transport? How do we engage with technology? How do we get those people to really focus on the emergency of all this? I mean, obviously it needs money, I suspect, and where do you get that from? But how do we actually get people to think about it? Rita, you've obviously worked with lots of different people, I think, probably in Greenpeace. So have you any thoughts on this?
Yes, a little backstory to that. I've just come off one of the Greenpeace boats, where I was working as a medic. And maybe just on that to say that it was, I took it as an opportunity to use that experience where I was just working as a medic on a boat, but I had a pretty unique opportunity to be out in the ocean, to be able to write about the impact of climate change on our oceans and how our oceans are so important and integral to human health. And so using any opportunity really as an advocacy tool. But I think one of the challenges that we face as a profession, and we were talking about this before the session, but especially off the back of the last 18 months, as a profession, we're very time bound and we're very tired. And I've read quite a few rebuttals about why should doctors even be climate activists in the first place? Shouldn't you just be focusing on human health? And I think this goes back to what Cheryl was saying earlier on, which is health is where you live, where you work, and where you play. And once we see that health is as a result of all of the wider social and ecological determinants of health, then we can begin to value things like prevention over cure, and we can start to think about what ecosystems are required around us to ensure health-giving environments. And I think recognizing that societally means that, of course, within construction, there's going to be thought of health and climate, and of course, within our agriculture industry, and of course, across all these different professions. And we're starting to see it within university institutions, and we're starting to see it in other places. But maybe I'll put it to the other panelists. How do we bridge out of our relatively siloed profession of, as health professionals and start to work with other industries.
Yeah, one of the way, I mean, I would absolutely fully agree with what Rita said. One of the ways I can't remember who taught me this, but one of the ways to engage people who you think are very different from you, who are not going to go along with, I mean, it doesn't matter whether it's the chief exec of your hospital, whether it's the construction industry or someone in the fossil fuel industry, is if you look hard enough, you'll nearly always catch someone saying something right. That's particularly true in a politician. You can go through what they've said and you'll find them saying something which is vaguely right. And there was one thing that's almost a sort of guaranteed technique of engaging is, first of all, to try flattery, to say, I found what you said there very interesting. I'm interested in helping. How can I help? What can I do to help you? Now, they may be very different politically or socially from you, but if you say to the construction industry, I'm a doctor, I help run a hospital, what do you think I should be doing to help you? What can I do differently? What are you looking to from me? That can help you overcome this issue that we judge everybody by the lapel on their jacket, not by the values behind their face. And it's very important. If you go and work with a politician who's quite a different color from you, you know, politically or skin color, it doesn't matter what it is. If you spend time with someone, you understand their values, and that it's the values that will bind you, not their political party, not their creed, race, religion. It's their values that will bind, and that will help you collaborate in ways that you might never have imagined. But you do have to spend time listening and offering. And we're not always great at doing that as doctors. We're very good at telling.
Well, I think when you look at what's happening, even in South Florida, we just had that huge collapse of our building, and we know the climate's involved. We have sea level rise. The industries cannot deny anymore. And so we already see, when you look at the projection in South Florida with sea level rise, the massive loss of coastal real estate and the impact that will have on the tax base and construction. And I was speaking with an architect who was designing this fabulous building and this fabulous new neighborhood. And I'm like, at 110 degrees, who's going to go outside and want to do this? And with all the mosquitoes coming and the vector-borne diseases, how are you designing for that? And I told one of the politicians, Marco Rubio's person, you know, who really wants to go to Disney World during the summer when it's 100-something degrees? So it's getting easier for where I live for people to start incorporating these ideas and seeking the relationship where they have to think about heat, the impact on health, and the vector-borne diseases, and even the flooding and all the other factors that's coming in. And how do I design? How do I construct around it? So unfortunately, because of the impact is so severe and our intense hurricanes, that we're getting that collaboration, but it comes down to money. They want to know the cost-effective way that they're going to make the most amount of money with the designs and the construction in the next 10 years. So I do expect us as clinicians to also understand that aspect, because as physicians, we have to learn how to meet people where they are. And if we don't understand their language as well, so when I translate my health message to a politician or to some sort of builder or someone, I do have to have some knowledge of what their challenges are, just like I do with my patients. I think that's why clinicians are so readily prepared, because we're always doing this. We're always finding ways to communicate best and translate difficult information and finding out what you're doing. If we do the medicine as we were taught, that's what we do. And so when I meet my politician or I meet my industrialist, the issues are real. They feel it, they know it. So then if money is an issue, how can I show you? Like I look energy efficiency, that saves a lot of money for our patients, especially the lower income. So how can you help improve the energy efficiency in the building? How can we switch over to LED bulbs? How can we do some factors that saves money on our end and saves money on your end and saves the planet? So that's the approach that I think we have to move. And centering again poorer people pushes you to find cost-effective solutions immediately, so you can get into that conversation with these people and move it ahead so we get some real impact.
Thanks, Cheryl. I mean, I think that's really important for all of us, in all honesty. We all see patients who are underprivileged, and underserved. So I think, thank you for that, making that point. Can I just in the last few minutes change tack a little bit, because obviously we all work in healthcare systems which are major polluters. So what can we do in our healthcare system to try and make a difference? I suppose one of the things I would ask is what low-hanging fruit what can we do quickly so that we really emphasize the urgency of all of this, and we can't take 10 years sorting it out. But what can we do both within the governance of the organization and actually practically in our own practices? I mean, there's masses going on, I know there are, but let's just have a brief chat about some of it. Rita, do you want to say anything from your perspective, working in Bromley Bow?
Yes, I will just very quickly say.
Quickly. Yeah, because we've only, I hasten to add, it's sort of a minute and a half for each person, because we've only got a bit of time left. Sadly, I'd like to go on for another hour.
What we found with this ecosystem mapping is that there's lots of group and lots of people doing very similar sorts of work across the country. Lots of small projects going on in trusts, in local GP practices. And I really think that there's potential for us to collaborate and communicate a little better so that we're not duplicating all the work that's going on, because I recognize that people are super passionate about it, want to be changing things in their local spaces. But what is pretty unique to the NHS is that we are more interconnected than other healthcare systems. And how can we change things on a more systems level within the NHS so that that frees up our time to be able to tackle some of the, some of the other issues that we're going to be facing.
Great, Rita. Cheryl, from a different perspective, tell us what you think.
Well, the US health system, so it has to be what saves money immediately. And we use a lot of single-use plastics, a lot of single-use things in our OR, our anesthetic gases, just a thermostat that we keep our temperature of the buildings, of the water. So there's a lot of low-hanging fruit, but I think we need a sustainability person in every hospital that is going to take this on and working with the residents and the medical students and the clinical staff and the lower level and mobilizing those teams to then push the hospital systems to make these changes rapidly and showing how cost effective it is. And I think that will get us a little bit closer, faster to the bigger changes.
I'm sure that would make a difference in the NHS too, let me say. David, final few words.
Yeah, one of the issues about, and it relates to both what Cheryl and Rita have said, is if you look at the governance, let's say of hospitals, the governance of hospitals is really what money do you put in and what healthcare activity do you get out. That's the basic equation. The healthcare activity does not equate to healthcare outcomes or health outcomes. And I think people get healthcare and health terribly confused, including us as professionals, actually. The two elements of governance we don't have in most health organizations, whether it be at a national level, a government level, a hospital level, or practice level, is combining, if you like, social and environmental governance with financial governance. That's what all big institutions around the world, especially forward-thinking institutions, are weaving together their financial, their social, and their environmental governance. We do it in a very ad hoc way. And of course, naturally, as health professionals, we think, oh, we're different. We've got special responsibilities. We're not different. We have the same responsibilities on the same planet. And unless we have some basis for weaving together environmental governance with financial governance, which is absolutely, as Cheryl said, the way in, that's where you start, but don't stop there. Weaving that together with social governance, because hospitals, I mean, we know in the US, how hospitals employ people in terms of equity, how they employ people, how they support small businesses, how they work with marginalized communities. It has a massive effect on health before any syringe or stethoscope is lifted. Massive effect. So we have to, and these are not threats, these are opportunities we're not exploiting. So it's our financial governance, Linda, as social governance, as good employers, procurers, partners, exemplars, and our environmental governance in terms of doing no harm.
Great. Well, I'm really sorry that we have to draw to a close at this point. I'd love to have gone on talking more. And I'm so grateful to Rita, Cheryl, and you, David, for joining us tonight. It's really been a pleasure and a really excellent end to our series at the RSM. I'd like to thank all the audience and everybody who's watched either tonight or on the YouTube options that are available. And thank you very much for being with us. I hope that you found it interesting and profitable. I'd particularly like to encourage you by saying that the RSM will be doing more work in the area of climate change. We're absolutely committed to this topic, which is a universal emergency right now. And so please keep watching on the website, and we do have your emails. We will let you know what we're doing. You will be sent a reading list sometime in the very near future to support what you've heard tonight. I would like to just finally end by saying a huge thank you to Michael Rapp, who has sponsored this whole series, which has allowed us to present these webinars and discussions free of charge to everybody. The RSM is now open and up and running again to everybody, with Freedom Day coming today. But I would say anybody that feels able to support the RSM with a small or a large donation, it would be greatly valued and would allow us to continue to running programs like this at no charge to the audience. So thank you all very much indeed. Thank you again to our contributors, and I look forward to meeting you in future meetings that are run by the RSM. Thank you and good night.